There's nothing more valuable that our universities do than create people that will go on to create change for good in society.
A lot of my primary research that I study is about the cost and effectiveness of the delivery of surgical care.
My primary research interest is in understanding disparities in maternal health in the United States.
I'm interested in the health of gender and sexual minorities, advancing transgender people's access to healthcare.
One of the topics that I'm hoping to work on here is related to glaucoma and the way we deliver glaucoma care.
My main interest is really quality of life in patients with dysfunctions relating to the urinary tract, reproductive tract, or sexuality.
My research interests are around variation in emergency department treatment patterns and variation in emergency department admission and discharge rates.
I study health outcomes after disasters among vulnerable populations, and particularly among older adults.
Medicine is a team. When I'm in clinic, pharmacists, nurses, social workers in those clinics are part of that team, and we're all helping our patients.
I have the opportunity to work with pharmacists, with nurses, with other physicians across disciplines that are different from me, and they have a different perspective.
As a nurse in the program, I would say my experience has been extremely positive. We would often talk about issues that were maybe physician specific, and I could talk about my experience and how nurses might do things differently.
I think it really gives us insight how we can sort of better communicate as a team.
That really allows for the room and the space that we work in to be filled with different ideas and different expertise. And that's been a really unique advantage at Michigan.
Everything about the National Clinician Scholars Program is focused on moving your work forward.
When you're thinking about what you want your career to look like, one of the most important things is to think towards the future. And you really need protected time for research development. And that's something this program really gives you.
There's a very strong research track here, especially in the field of statistics, and being able to actually run your own statistical program. It's very, very strong here, and that was also a major draw to the University of Michigan.
If you think that healthcare research can serve as a tool to advance policies and healthcare that we provide, the National Clinician Scholars Program is a wonderful place to learn.
There are world-class, internationally recognized faculty and researchers that I knew I wanted to work with.
Being at the University of Michigan is really unique because we're housed in IHPI. And with that, you get this really exciting, diverse group of researchers who are here to support and work with you as a clinician scholar. Any question, any research topic you have, there's probably somebody else here who's interested in it or can provide the support you need to really see it to completion.
I think it's one thing to have people in place and have resources, but to have people in place who are willing to help you, who are really nice, is very special here at the University of Michigan.
The mentorship piece is really important in a developing researcher, and University of Michigan, the program here has amazing mentorship.
I think that's the thing that appealed to me most about Michigan here, about coming here, was the really broad range of mentors.
These are going to be lifelong relationships, and for me, that piece of this program has been invaluable.
Each cohort has so many people that come up with new ways of looking at important issues for keeping people healthy and helping those that are having health issues.